Hello everyone, welcome to my YouTube video channel. My name is Ajibola Morolake. I'm a registered nurse. To my subscribers, welcome to my YouTube video channel again. And if you are viewing me for the first time, welcome to my channel as well. My channel is all about enlightening individual, families, the public about some health challenges which can be prevented if individual has the knowledge to do so, or to educate about some health challenges that need to be managed properly in order to prevent complication. So today I'm going to talk about women health. And you will all agree with me that women health is so important. Women health is tied to the development of a nation and even tied to the economic of a country. So I'm going to talk about women health. Today, I'm talking about pregnancy-induced hypertension, which is account for 5 to 10% of risk in pregnancy. I'm going to talk about the definition, the signs and symptoms, the causes, the physiology, the treatment modality, and the complication that can arise if it's not properly being managed very well. So what is pregnancy-induced hypertension? Pregnancy-induced hypertension is elevated blood pressure after 20 weeks of gestation in a woman that has normal blood pressure before pregnancy. So it's also known as gestational hypertension. Pregnancy-induced hypertension is diagnosed when the blood pressure is more than 140 systolic and 90 diastolic millimeter of mercury. When the blood pressure reading is more than 140-90 millimeter of mercury, that is when a woman can be diagnosed of pregnancy-induced hypertension. And this diagnosis cannot be made as a result of a single blood pressure measurement. It has to be more than one blood pressure reading in an interval of 4 to 6 hours, and they have to eliminate that is not stress that is increasing the blood pressure of a woman at that particular time. They are going to eliminate is not just when the woman is just coming in, rushing into the clinic, and the blood pressure will be checked. They are going to eliminate any other factors that can increase woman blood pressure during pregnancy. Who are at risk of pregnancy-induced hypertension? There are some risks for this condition. Those at risk are women who has history of pregnancy-induced hypertension in their previous pregnancy, or women with kidney injury. Age is also a factor in a woman that's below 18 years and above 35 years of age. It's also a risk factor for pregnancy-induced hypertension. What are now the signs and symptoms for pregnancy-induced hypertension? Most of the time, women may not complain of any signs or symptoms. It's only when their blood pressure is being measured that they are going to actually discover that this woman is having high blood pressure during pregnancy. But in some women who have complained of their own with this condition, some of the complaint may be severe headache that linger for a very long period of time in pregnancy. Vision changes. Women may say they are not seeing well. There is changes in their vision. Their vision is being clouded. So these are the signs and symptoms and complaints for women who have been diagnosed of pregnancy-induced hypertension. What is now the cause of pregnancy-induced hypertension? Normally, during pregnancy, there is a physiological changes in the pregnant women's body in order to accommodate the new baby's fetus in utero, in order to increase blood flow, oxygen to the baby in utero. There's going to be changes in the blood vessel to accommodate extra blood need because of the baby in utero. But when this does not follow the normal pattern, when there is dysfunction in the formation of placenta, this leads to pregnancy-induced hypertension. What actually occurs is that in a normal sense, the blood vessel is supposed to be in a spiral shape whereby it allow more blood flow to the baby in utero. But when there is abnormal formation in blood vessel, they are going to lead to vasoconstriction of the blood vessel, which increase the blood pressure of this woman that is experiencing this condition. So this is when there is elevated blood pressure. What is now the treatment for this condition? For a woman that's been diagnosed of pregnancy-induced hypertension, they have to be monitoring their blood pressure properly and regularly. They have to come for their antenatal regularly, and if they are being advised for bed rest, they should adhere to that. They are being admitted for bed rest in order to monitor their blood pressure and to monitor the condition of their baby in utero. This is so important. So, and there is also a drug of choice for women with pregnancy-induced hypertension. The cardiologists, obstetrics, and gynecologists are going to consider the health of the woman because of their condition, and they are going to consider the baby in utero as well to make a choice of drug for them to use. So these are the treatment regimen for pregnancy-induced hypertension. But if this is not being managed properly, or the woman did not book on time to actually diagnose them on time, it may lead to complications such as pre-eclampsia. What happens in this state is that there is organ involvement already. When there is elevated blood pressure, the blood pressure is more than 140/90 millimeter of mercury. There is also reducing permeability of the kidney. The kidney function is also to regulate what is going in and out of the body, to produce urine, to excrete waste product. But when there is dysfunctional physiological system, when pregnancy-induced hypertension occurs and is not being managed well, there may be reducing permeability of the kidney, and the kidney may actually retain some waste product that's supposed to go in. The kidney will be retaining fluid. So this leads to organs involvement. There's going to be proteinuria. There's going to be protein in the urine. If the urine is being tested for protein, there's going to be protein in the urine. There's going to be increased retained fluid. This shows in the woman, where the woman look puffy, all the part of the body look puffy, not only in the leg alone, but every part of the body now look puffy. There is need to probe this further when a healthcare provider sees that the woman is puffy more than normal. So there is need to do EU and creatinine, electrolyte urea and creatinine to ascertain the function of the kidney. With this investigation, if there is derangement in this investigation, this indicates that there is organs involvement already. So in pre-eclampsia, there is going to be protein in the urine. Normally, if dipstick is being used, dipstick is going to show more than 1+ of protein in the urine. This shows the woman is in pre-eclampsia state. And how can this condition be monitored? The woman can be on bed rest to monitor the baby utero and the mother's health, and also to monitor the condition which the woman is in already. In this stage, they are going to admit the woman to the hospital to monitor the woman and to doing investigation to know the condition of to know the systemic functioning of the woman body. So another additional drug can be added, which is magnesium sulfate. It can be given intramuscularly or intravenously to actually prevent another complication, to actually prevent eclampsia state, which is the seizure state. So in this state, if it's being managed well, it's going to avert the complication. Another thing to consider in this state is that if the baby is viable already, if the woman is like 36 weeks and above, according to the description of obstetrics and gynecology, they can actually plan for the delivery of the baby. Since the abnormal formation of the placenta as a result of the pregnancy is causing this problem, there may be need to plan for the delivery of the baby at that particular time in order to prevent any other complication. So it's so important. So when this is not being managed properly, or the woman presents herself late, and and the condition has graduated from pre-eclampsia to eclampsia state. This is the seizure state. And why is this the woman actually having the seizure fit? Is as a result of CNS irritation. When there is accumulation of the fluid, as the kidney is retaining waste products, the kidney is retaining fluid, the lung is also retaining fluid. There is pulmonary edema, which can cause breathlessness. There's going to be increased fluid in the brain also, which causes the irritation of the brain, and it can lead to seizure fit. So in this state, apart from antihypertensive drug or magnesium sulfate that is being given to the woman to prevent further seizure, there's going to be additional drug regimens like mannitol.
Mannitol is a diuretic medication that is used to get rid of excess water in the body and increase urine output. This drug can be used for a woman that is experiencing eclampsia seizure after the delivery of the baby, or in order to get rid of excess fluid in the brain to prevent further seizure for this woman that is having a seizure fit.
Another complication of pregnancy-induced hypertension is HELLP syndrome. In this state, there is hemolysis of the red blood cells, breaking down of the red blood cells, elevated liver enzyme, and low platelet counts. When there is hemolysis of the red blood cells, there is jaundice of the eye, of the skin, sclera of the eyes, and of the skin is being noted. So it indicates that the liver is being involved, and there is hemodialysis, excessive breaking down of the red blood cells. And when there is low platelet, these increase the chance of the woman having blood clots. So this is another complication on its own. That is why it's so important. And if care is not taken and is not being managed well, it can lead to unconsciousness, and the woman can go to coma, and death can also occur. So that is why it's so important to manage a woman with pregnancy-induced hypertension very well in order to prevent all these complications. As a woman has the side effects and complication side to pregnancy-induced hypertension, the baby also have their own risk as well. There's going to be growth retardation because the baby is not receiving enough nutrients and blood pressure. There may be retardation in growth. The baby may not grow properly according to their gestational age. Another thing that can happen, there may be placenta abruptio, where there is a premature detach of the placenta. So this can also occur. Intrauterine fetal death can also occur as a result of pregnancy-induced hypertension when it's not being managed properly. So I've come to the end of the video. Please, if you like what you've heard, kindly like my video, and you can make your comments, which I will attend to. You can also share this video to others, maybe the decision makers, the husband of the pregnant women, that they may need to make decision when their wife is being diagnosed of this condition is very, very important. So I've come to the end of this video. As a woman, be in charge of your own health. A female child too must live to grow. Take charge of your health. Bye for now. Until next time, I'm doing another video. Bye bye.